Okay, thank you everyone. I'm Rachel Hostler. I serve as the co-director of the Renaissance Center with Derek. I have the pleasure of introducing our next speaker today. John Aller serves as the executive director of Stark County Mental Health and Addiction Recovery. He guides the administrative, clerical, and fiscal responsibilities of Heartland East Administrative Service Center. StarkMHAR, under his leadership, has been reorganized for delivery of a wide range of cutting-edge services to Stark County residents, as well as its partner organizations. John has a bachelor's degree in psychology, master's in community counseling, and is currently enrolled at Kent State University in their public health PhD program with a concentration in health policy and management. He is an active member in various state and local boards and communities and is a federal behavioral health reviewer. John is currently the chair of the Ohio Association of County Behavioral Health Managed Care Committee. Please welcome John.
Good morning. It was nice to hear the panel of judges, and it is interesting, and I would just note that it's important that as you look at the panel of judges, I talked to Judge Stormer as she left because I used to go in front of her when I worked in Akron, in front of her in the late 90s with dual diagnosed clients, and so certainly she has helped kind of guide that and is well established in the community. Judge Warren, as he mentioned, used to sit on the Stark County Mental Health and Addiction Board, and frankly has been a really driver in kind of creating that court and is always looking for feedback and opening, is actively involved in the community. And Judge Leoy actually interviewed me for Leadership Stark County and sits on a number of local foundations. And so part of why these projects work is because the court and the judges are kind of integrated into the community and kind of understand what some of the other drivers are. And so my goal today would just be to give you a high-level overview of what's happening. There's some things that are happening in our community right now around suicide that you're all aware of. There are some things that are happening from kind of a system perspective that are driving some of the way services is being delivered. And then there's just some social issues that we have to be aware of. And then hopefully offering some solutions. So what StarkMHAR do, I would just drive you to, we take a public health approach to mental illness and addiction issues. So we're trying to support wellness and recovery through innovations in funding, collaboration, advocacy, and education. So challenges facing our community, many of you are aware of those, and I'm going to touch on them briefly. But opiate epidemic, we heard some of that, some of the data coming out around the opiates, and you guys are aware of that. I will just tell you that yesterday, the Department of Health released some statistics. I think my numbers are right. If they're not, they're really close. But I think about 60 overall, the state of Ohio opiate deaths went up. 62 counties, the opiate deaths went up. 26 counties, they went down. I can tell you that our opiate numbers from 16 to 17 went down by about 30%, and they're also trending down this year. I want to be clear, any loss from an overdose is too many, but it does feel like we are having some impacts, and I'll go back to the collaboration with the criminal justice system. There are counties in Ohio that still do not allow police officers to carry Narcan, and Stark County has adopted Narcan and has used that for the last 10 years. And again, Narcan is about saving folks, but you got to get them into treatment. And so some of the way we're coordinating care, you'll see that we very rarely encourage folks to give Narcan without trying to engage folks into treatment. But as I say all the time, you can't help somebody if they're dead. And so you'll hear lots of research. You'll hear lots of people say that people are getting multiple doses of Narcan. Again, I will tell you that happens, but when you look at the data, it's very infrequent. And so you can't use those exceptions to drive policy. And so I just wanted to make sure that people understood that opiates continue to be a challenge. As the judge said, as opiates lessen, we are having people pick up on meth and other things that we need to be aware of, but just wanted people to be aware of that. Suicide contagion, I'm going to Columbus to present on suicide. As many of you know, we're in the middle of a contagion right now with adolescents. When you look at the chart, for whatever reason, from last school year, we had the loss of a number of young adults, which is significantly impacting our community because traditionally we had maybe 1 or 2 in a period of time, and over the last year we've probably had 14 or so. And so again, we're just continuing to try to look at what drives that. Access to services, one of the things you're going to hear from me is that we really feel like it's important from the board perspective that our job is to try to promote access to service. And so the quicker people can get into services, what we're pushing towards, which you'll hear about in a minute, is agencies that we fund, we're pushing for same-day access. That might be a lofty goal and isn't going to happen today, but we're going to continue to chip away with that because people need to have almost immediate access to services. Fragmented system, just will point out the challenges with just kind of systems and some of the drivers, which I'm going to talk in a minute about funding. Many of you saw that Altman just closed their psychiatric unit. And so again, Altman has to make business decisions. The challenge for a community is that it's difficult as people move into different levels of care that you have to move them from provider to provider. And then when you put them out of county, it all of a sudden creates a significantly different challenge because, you know, how do parents access, how do they get there? How do parents access those services? And so, again, we have to do a better job as a community, but also, frankly, just as a behavioral health system in making sure that people can seamlessly transition through the system. And then health disparity, I don't have to tell you, but we need to be real and talk about the differences in health disparity. So why, if I'm a minority, do I get diagnosed with a disorder for mental illness that seems to, so I'll give you an example. We know in our community that if you are African American, a juvenile male, that you get diagnosed with a conduct disorder at significantly higher levels than if you're white. Why does that matter? Why it matters is all of a sudden I have a conduct disorder and then I go in front of the juvenile judge and they see I have a conduct disorder. All of a sudden that changes the way people look at them. And it's not just about looking at do you have minorities and people with health disparities showing up at your front door of your agency, but also, frankly, are they completing treatment? Because it's not about just people getting into treatment, it's about are they being successful on the other end. System changes, I'll talk briefly about these. You know, all behavioral health in the state of Ohio in the public system went into managed care companies. So if I was an agency that provided services before July 1st, well, actually, if I'm an agency that provided services before January 1st, this is how it's changed just since January 1st. I used to bill, say, 12 or 14 codes. I'm now responsible for billing about 150 codes. And oh, by the way, instead of billing one entity, I now have to bill 5 different plans, all of who have different rules. And so that's just kind of a challenge for agencies. They have to change the way they provide business. They have to add additional costs to support that infrastructure. But that's one of the things that drives how services are being provided. Criminal justice reform, which we think is a positive, but there's been some changes at the state level where they're continuing to have less people eligible to go to prison, which we think is a fantastic development. I think the challenge is, as the judge was saying, is that they never attach enough money to bring them back to the community. And so I just heard this morning from somebody that our jails are being overcrowded right now because we have people that used to go to prison for a period of time that are now in the local community, and the challenge is what do you do with them? And so again, that's how criminal justice reform throws it out. I would just encourage you, and I'm not taking a stand, there's an issue 1 that's on the ballot in November. I would encourage you to get educated about issue 1 and just read about it. But that is something that has some really key components that everybody agrees with, but there's also some challenges around the impact of drug courts and those types of things. So I would just encourage you to look at that. Healthcare delivery, we talked about it just on a wider scale. I mean, we're trying to co-locate services with the agencies that we work with in the physical health environment. So if I walk in as a 16-year-old child, it just happened the other day, but if my 16-year-old, not mine, but somebody I know, their 16-year-old son walks in and starts talking about some mental health issues, they can just be walked down the hall and get an assessment and start getting services. And so that's one of the things we're looking at doing. And then the last thing, which I'm going to spend a few minutes about, which kind of relates to access, we are in a workforce development crisis. It is full-blown for behavioral health right now, and if we don't get it figured out, you can talk about access to treatment and the importance of people having access to treatment, but what I say all the time is that if somebody brought to me tomorrow 100 independently licensed social workers or counselors, I could have 90 of them placed within 4 hours of them coming in the front door, just because workforce development is a significant challenge that we have to address. Social determinants of health. you know, the other thing is that if I'm predisposed to having a mental health or an addiction issue, things like this really impact folks. And I would just encourage you, this is where public health and that public health model really kind of is key, because you're looking at everything surrounding the person that impacts them. And so things like how stable is the family, what neighborhood does people live in, how close built environment is, how close are they to access services. It's different if you can walk to the grocery store or drive a couple minutes to the grocery store, or if it's a 5-mile trip and you have to take 3 buses to get there. That does impact your family. Health and healthcare, how readily accessible is it? Social and community context, I'll just talk briefly about this, but one of the things that I don't think we spend enough time on, especially as we're talking about legalization of marijuana or medical marijuana, is, to me, it doesn't really matter whether it's that or alcohol. What we do know as a community, the more accepting you are of alcohol and marijuana use, the more use you're going to have. And so I think that's the thing that I struggle with at times is, so I live in Greene. Greene has beer gardens at festivals. That's fantastic for people to be able to drink, but I will just tell you the research is really clear. The more kids perceive that alcohol is okay, and it's okay to have mom and dad go to a festival and sit and drink in the beer garden, that does change their perception of use. And that's what we need to be realistic and really look at. And so I would just encourage you that those are some issues we have to be aware of. Ways communities responding, I'm going to do these quickly. There is a coordinating care around suicide prevention based on the CDC model. It involves schools, it involves the board, it involves health departments, it involves the criminal justice system, it involves a lot of entities that are doing planning. Hospitals, Altman certainly sits at the table. Talked briefly this morning, criminal justice initiatives, rapid response teams. We do have teams in the community that are going out, and if somebody has overdosed and gotten Narcan or they've overdosed, they're going out and checking on them and trying to get them engaged in treatment. Behavioral health positions at the jail, we currently fund a number of positions out at the jail, so when somebody comes into the jail, they're given an assessment, and in practice and theory, they're then connected with a treatment provider, so hopefully the day or shortly thereafter that they leave, they can get connected into treatment. Task program they talked about, Judge talked about mental health, drug, and veterans court. And drug take-back day just happened yesterday, so I'll just throw this stat out to you. We started drug take-back days in 2010, and basically that's just an opportunity for you to go and turn in any medication you have over the counter, prescription medication at any of the police departments in the county. I would also encourage you that if you miss that day, you can go to every police department, and they have a box there that you can open up and put in. Why is that important? Why it's important is what we do know about opiates, especially when people are starting to use. Over 80% of people, the first couple times they use, get them from family or friends. And so I would just tell you that, you know, I have people say to me all the time, well, I don't think my kid's using. First of all, I have a 15-year-old and a 19-year-old. I always trust but verify, so I don't think I'd ever make a statement like that because I'm not sure. I think they're not. But I also think the other important thing for us is but they have friends, there's family members, and so I would just encourage you to get them out of your house. Why is that important, and how successful has this initiative been? Since September of 2010, we have collected as a community 55,000 pounds of medication. It's hard to believe, but you literally, when you work those sites, you'll have an 80-year-old grandma walk in and say, I cleaned out my meds because I'm moving, and the one that I can remember is a couple years ago, she had 23 black trash bags full of stuff. And again, they just accumulate over time, but I'll say to you, we kind of didn't take this serious, and just a few years ago, we've cleaned out our medicine cabinet, and we're fairly healthy and haven't had a lot of problems. We had 3 bags of trash bags full of stuff. So again, it's just getting it out of the house, making sure that you eliminate access for use. Coalitions, Opiate, Drug Force, Family Council, Parents Who Host, you know that. School-based mental health. Somebody asked a question about what we can be doing in schools. We're pleased to announce that through the partnership we have with the school systems in Stark County that we're currently providing mental health services through our agencies in about 100 of those schools. And frankly, we're investing well over about $1.4 million of investment. Not enough, needs to be more, but that's how we're trying to address to make sure kids can get streamed and kind of connected into service services and have access. And youth and mobile crisis teams, 24/7, you can call the crisis line, go to our website, or go to Coleman, who's now running that service. But the service that we have available in Stark County is if I'm a mom or I'm a wife and my husband is expressing suicidal ideation, I can call that number, and within 30 minutes, somebody will be out to interact with your family face-to-face. And so how does this often happen? Often it happens because they call the sheriff's department. It just happened in Minerva a few days ago. They called the sheriff's department in Minerva. The sheriff's department calls the crisis unit. We're able to keep that 30 minutes, although I'm not quite sure I want to know how they got the call and drove from downtown Canton to Minerva in 30 minutes, but that's okay as long as they're doing it safely. But the point is that then at that point, the professional can kind of work with the family to determine whether they need to be hospitalized or they can put a safety plan and keep them in the community. Why is that important? Why it's important is because about 70% of the people that we're seeing stay in the community, and what we do know is that if you can keep and wrap services around people in the community and not pull them out of the community to be hospitalized, they get better outcomes from that process, and so that's something that we're doing. I'm going to run short of time, so I'm going to be quick. One of the things we're doing around access and workforce development that I just wanted to throw out, which is kind of, we think is a creative initiative, and you're going to hear more about it, is we're working with the University of Akron around an MSW cohort. We're happy to work with Walsh, the next phase that we do that, or even Malone. But I'll talk briefly about that. We're also looking at mental health advanced practice nurse recruitment, and we have talked with Walsh, and we're also working on a pilot project with Kent State around that. And the last thing is we're just doing overall recruitment and retention. So let me talk about the MSW. Why are we focusing on MSWs instead of licensed clinical counselors, which I am? So naturally, I would have leaned towards that if we could have. Why we're focusing on independently licensed social workers is because in the state of Ohio and at the federal level, you cannot bill Medicare unless you're an LISW. And so part of our challenge in our community is we have a lot of Medicare clients that our agencies serve. And so the ability for them to be able to, at least through this first phase, to bill Medicare helps us, frankly, because we're currently paying for those services, because if they don't have a licensed social worker, then it trickles into our system. But we're also just looking at kind of piloting a project. So what's going to happen is it's an agencies that we fund along with the board and staff partnership. We're kind of looking at creating career paths for staff. So we think it's important that if staff come into you initially and identify themselves as having an interest in this, that you can kind of show them a path that they can kind of follow if they choose to become independently licensed. The thing that we're excited about is that it's going to be located in the county at our board office. They're going to come and do it 2 nights a week from 4 to 10. The benefit for the staff of the agencies is that they don't have to drive to Akron, they don't have to fight traffic, and they can get all the services they need, in one place. Benefit for us is it kind of creates a community, hopefully, or a cohort that they can kind of work their way through a 4-semester program. And the benefit for the clients that we serve is hopefully when we're done, we can take up to 30 people, even if we have 20 of them graduate, which that's 2/3 of them graduate, which we're hoping to do better than that. We then will have 20 people in the community that can provide behavioral health services that we didn't have before. So we are looking to model that and do something really similar through professional clinical counselors next round. APN, our field has changed, as many others have, is that, no longer is our field using psychiatrists to the extent we did. One is because of cost, and the other is because they're difficult to find. And so what we're moving in our field is to using advanced practice nurses. And so we're working currently with Kent State, and we have had conversations with Walsh, who's their program that gets brought up. But how that's going to work is, at least with the Kent State program, is those students have to do 4 internships. And currently they're not getting paid for that. We think that we are going to offer a stipend to those nurses in conjunction with our agencies, which will allow us to do 2 things. One is it'll allow them a little bit of a stipend. The second is that when you're offering a scholarship, then you can interview them. So hopefully you're getting the best candidates. But then we would run them through those 4 internships around our agencies so they can get familiar with the behavioral health system, can get a vast variety of experience, but also, frankly, our hope would be then that they will connect with the system, not be so afraid of the system, understand how the system works, and then we're going to offer them positions in our agencies as we move forward. So that's the model we're going to use. We'll see how it works, and then that's kind of that piece. The other thing we're doing, which we're going to roll out over the next couple months, is that any advanced practice nurse in Stark County who works in the public system will be given kind of a course, which they'll meet on I think at this point it's a monthly basis, but there'll be a monthly training day. It's being facilitated by a seasoned physician who has worked, a psychiatrist who's worked in the field for a long time, but they're going to cover topics such as differential diagnosis, med safety, risk management, and trauma. Why do we think that's important? Because it's challenging for docs, and it's also challenging for advanced practice nurses. My wife's an advanced practice nurse, but it's challenged with the amount of training they get to all of a sudden be dropped into a system where you have to know a lot of stuff, and how do you differentiate between somebody that has ADHD and another thing that looks similar? And so we just think this training module will be important. The other reason we're doing it is that it allows, frankly, them to build a community within themselves, so hopefully they can feel that connection and stay in the system. Create education and networking opportunities facilitated by a physician, as I talked about. And then last thing, and I have 1 minute left, is that we are working around recruitment and retention. And so we will be working with the agencies that we fund through our provider network with a consultant who will be helping them to develop individual agency retention plans. And then we'll be looking at ways that we can help support that. And I'll just tell you this, that, and again, we don't provide direct service at the board, but we certainly are actively busy. But we're spending a lot of time even at the board talking about how do we retain staff. Because it's challenging at times with the environment we're in. And so we've done things like have created alternative work schedules. We're doing things right now around just kind of engagement activities. But I do think that one of the challenges that our system has, the behavioral health system in the community and in the state and nationally, is that we spend a lot of time talking about how to recruit people into our organizations. We don't spend enough time talking about how do we keep them engaged and connected. And so that's going to be one of the initiatives that we have moving forward. And so, again, my challenge as I put the presentation together was kind of making the transition from the morning session into the afternoon session in the panel. But I just wanted to give you a little bit of an opportunity to see what some of the challenges were in the system, what some of the drivers that agencies are currently facing, but also you're seeing that we are trying to work collaboratively in the community and really work on workforce development and access. And again, my goal and I was going to say guarantee, I won't go that far. My goal is when I'm sitting here doing this presentation in the next 3 to 4 years, that we'll be able to announce that we have immediate access for services. And so that is a lofty goal, but that is the right goal, and that is what we should be doing as a system. And so I can tell you that we currently have agencies in our network who have same-day access for service. And that's where we need to head as a system, because if I'm suffering a mental illness or I have an addiction disorder, I need to try to get access to services as quickly as I can, which hopefully stops a lot of those bad outcomes that we see if that's not in place. And so, again, that's kind of the passion or the guiding thing that's trying to push us. And I would just encourage you that if anybody would like to partner on any of these initiatives or would like to work on any of these initiatives, we're certainly happy to do that. So, thank you.